that too, because I'm gonna lay down up here. I'm not sure that I'm going to or not. Depends on what I can see. Okay, so what I'm looking for is I want to come along to, that is her PSIS. So you want to come along that and drop down to about the first sacral notch. Are you tender along there?
Yes.
Oh my goodness. Okay, so from about the first sacral notch, can y'all see?
Yep.
Okay, about the first sacral notch there. I'm gonna do it this way. All right, sit tall, and now slump down. Sit tall, and slump down. Okay, I don't know what y'all can see. Are y'all with me? Can you see? Are they moving evenly? Are her joints moving evenly is what you're looking at. Does one move more than the other? They should both. As we move into anterior pelvic tilt and posterior pelvic tilt, things should be the same, right? You shouldn't have one go up and one stay still. It shouldn't happen that way. So, but just because one side moves more than the other one does not mean that that one's hypermobile. Maybe that the other one is hypomobile. You're not just tracing pain either. You are looking and making a clinical decision of what you think is the problem. Because it may be that one feels like it's moving too much, and it may feel like one's not moving enough. And you just have to get your hands on enough people and do this enough times that you kind of have an idea of what's going on. So, all right, so here we go again. Okay, so sit tall, and now slump down. And sit tall, and slump down. One more. Okay, now, do you think is it worse when you're tall or is it worse when you're slumped? Do you have more pain when you're in anterior tilt or more pain when you're in posterior tilt?
I have pain whenever I'm standing for long periods of time.
Okay.
So anterior tilt.
Okay. So she doesn't necessarily have pain right here, but her activity when I'm standing for a long time. Okay, which brings us to something else that I'll probably have Donisa teach, because how much of our practice is dedicated to teaching people how to activate their transverse abdominis, right? How much?
All of it.
It is huge. The transverse abdominis muscles, if they are not working and your pelvis is loosey-goosey and it allows things to move in ways that things are not intended to move, it's horrible. It's horrible. So it has to be strong, it has to be solid, or you're going to have problems. You may not have pain, but you're going to have some dysfunction. So she tells me that she has more pain in standing, so I'm thinking automatically it's a tall sitting problem. What I see is, I think it's the left side that's the problem. What that means in my mind is that I've got a left on right, thinking about the way that it rotates on the axis, a left on right rotation, which it doesn't really mean anything to y'all except that for her, we're going to treat her so that we're addressing this tall seated posture. Okay? Can you lay on your side? I'm going to have you lay on the right side. Okay, so what we're trying to do, it's a muscle energy technique. What we're trying to do is get her to activate these muscles here to help to mobilize the sacrum so that it's going to put her in the position where she needs to be, and hopefully then give her some exercises she can do so that she's stronger. Okay, so for the tall seated, the left on right torsion, what we're going to do is have you bend both knees forward. We're bending both knees forward until we feel a little bit of movement in the back. Then I'm going to support this leg, move your bottom leg back till it's straight. Okay, so there you got that. Now I want you to roll your top shoulder backward. There you go. Is that as far as you can go? Okay, so right there. Okay, so now we have isolated these hip muscles. She can't use core, she can't use shoulder, she can't use her other leg. She's going to use her left external rotation and her left abductors. Okay, so now hold your leg up. Don't let it fall down. 6, 7, 8, relax. Is that hard? A little bit hard to do, okay? So now scoot we're gonna do that 3 times each time you progress the position. So scoot your bottom leg back.
Wait, which one?
Your bottom leg. There you go. Yep. Okay, so now your shoulder's already back. Hold your leg right there and don't let it fall down. Oh, hold it up, hold it up, hold it up, hold it up. There you go. 6, 7, 8, 9, 10. Relax. It's hard, huh?
Yeah.
Okay.
I'm relying a lot on my shoulder
Uh-huh.
to like keep me.
Right, to keep you from falling. Okay, scoot your bottom leg back. Roll your top shoulder back. Okay, so now we're gonna do this again. Hold it up, hold it up, hold it up. 1, 2, 3, 4, 5, 6, 7, 8. Relax. Okay, now bring your bottom leg forward. And then I let them just get comfortable. And then I usually just rub that a little bit. Just make them think I'm actually doing something for them. You don't really have to. It's just sometimes it is a soothing, for someone to, okay, I work these muscles now. Someone's just gonna take care of me for a second, because really and truly it's not. But I have other things. Just want you to know that. Okay, so then, that being said, now I'm gonna have her come sit up. So now let's come sit up. You just put your feet right there. That way we don't have to turn all the way around. Okay, so now we're here and we're gonna look at this again. So we're here, okay, and you're tall, you're tall sitting. Okay, now slump down. And now back up. And back down. And I don't know if y'all can tell what that looks like, but that's better. Because a while ago, this left one wasn't moving at all, and now at least they're even. They're moving evenly. So now, that being said, now, if she were my patient, we were in the clinic, I would have her lay down and we'd do some transverse abdominis strengthening. Are you ready to do some strengthening? You're gonna be sweating like all get out. Okay. I'm just teasing. Let's go ahead and let you lay down.
On my Apple Watches?
Yeah, please. Put it on your puppy's tail so that. Okay, go ahead and lay down. On your back. Hook line. I don't care which, it doesn't matter. Okay. So how can you get a transverse abdominis to kick on? How do you get them to activate? You what?
I said the huffing.
The huffing.
There's a lot of huffing.
There is a lot of huffing. So, I've tried and I've tried and I've tried to teach people different ways to do this. I was doing home health and I got really, like my core was weak. And I have never been weak in my life, but I had patients coming into the clinic who were stronger than I was. They could do things better than I could. They could bridge better than I could. They could do exercises. They could sit on a Swiss ball better than I could. I'm like, no. So I've worked at this until I'm fairly good at it. So I can kick my transverse abdominis on without even worrying about it anymore. But the easiest way to get someone to do that is to have them diaphragmatic breathe. Put your hand on your belly, put one on your chest. I want to feel your belly rise without your chest rising. So inhale, and then exhale. Okay, so that's all there is to it. That's step number 1. Diaphragmatic breathing. Because they have to be able to do that. Because if they're breathing from up here, they're not even activating all of this down here, right? Okay, so now, when you exhale, I had 2 older sisters, and one of them would breathe in my face. Especially if she'd burped or eaten onions or something. That's the kind of exhale it is. Like you're trying to get your breath to the ceiling, like you're fogging up a mirror or a window. That's the kind of exhale it is. And it's not, it's, okay. What you don't want is for them to arch their back as they breathe in. If they do that, we just talked about tripoding. Why do people tripod? So that their ribs can expand more, right? So if they're arching their back, they're using this part, not this part. Okay, so relax for just a second. So that's number 2, I guess. First one's diaphragmatic breathing. The second one is this. So put your hands here and think about, y'all know your transverse abdominis runs. It is like right along, it goes from a little higher. But if you get your hands like to the inside of your pelvis, that your transverse abdominis runs down this way and it makes a part of the pelvic floor. Has Diane already been here? Has she already talked to y'all about pelvic floor, Paige? She already talked to y'all about transverse abdominis? Okay.
I think so.
All right. So the transverse abdominis runs right here. You know, you can tell people act like your hip bones are headlights on a car and you want to try to bring them together, like you're crossing your eyes or whatever. And yes, that's what happens. But if they can't activate it that way, then zero good, right? So you have to get them doing it in a way that it actually makes sense. So put both hands just to the inside, and you want to like push in a little bit. Now inhale into your belly. Inhale. Oh, not up there. Good. Inhale into your belly. Good. Now. And I'm going to tell you when you feel it. It's not during the time you're exhaling. It's when you have exhaled, just before you take that next breath, you feel those muscles kind of reset. You feel that? It's the funnest, weirdest, craziest thing you've ever seen in your life. It's like, okay, we're breathing. I just taught my patient to breathe. It's a good day. But if you can incorporate that now into functional movement, okay, you can relax for a second. You want to realize that you do 5, maybe you do 3 of them. They need a break, especially if they've not been used to activating their transverse abdominis. They may need a break quicker than what you would think, because those muscles, if they've not been activating them, they make it too easy. Go ahead and stretch your leg out. Okay. All right, I want you to just do a straight leg raise right now. Just raise it up and back down, okay? Now then, I want you to do a straight leg raise with that exhale. So you're gonna inhale into your belly. Now as you exhale, raise your leg. Okay? I kind of like that. Okay, so not so strong of an exhale. It's like, okay? And start the exhale before you lift your leg. Okay, so let's do it again. And I don't know. Yeah. So I don't know if you guys noticed or not. When she did it the first time, her pelvis looked a little unstable, and I had her do it before she exhaled. With the second exhale, she looked unstable. She was using that leg for stability. This time, she did kick her TA on. And what did you say? I felt it this time. So she looked more stable, but it's hard, huh?
You have to really think
You
about.
do have to think about it, because it wants to, we've been used to not doing it. Little kids do it all the time without even thinking about it. But as we get older, we learn how to not. So let's do it one more time. So that's just another exercise. That's just another way to incorporate it. But we're not doing it for quad strengthening, hip flexor strengthening. We're not doing it for the leg. We're doing it for the core. We're doing it for this transverse abdominis to get all of this going so that she's more stable here. Now, functionally, go ahead and you can come to that. How do you incorporate that into functional movement? I'm fine as long as I'm not standing. If I have to stand for a long time. You may be losing your TA. You may be losing control there, which allows you to hang on your ligaments, which makes more pain. What about, it hurts when I stand up.